We set the practice up really as a cutting-edge practice to provide high-quality dentistry at an affordable price, giving the patient the opportunity to make really good informed choices about treatment. Well, because we spend a lot of time right at the beginning of treatment actually looking at how the patient will end up, we end up with very, very satisfied patients.
The patient is the centre of our approach, and when we do the treatment planning we keep this in mind.
When I saw how caring Ian was with Paul, I decided to come to Ian, and I've never looked back.
I've been a patient at Dentique for 25 years. I've had my crowns replaced, I've had my teeth whitened on occasion.
Ian suggested that I might like to have some orthodontic work done. I was surprised that anybody would bother with somebody of my age to suggest it would be done, and I was so pleased.
We have really two main ways of moving teeth these days. One is lingual orthodontics, which is where we put the brace or the brackets inside the teeth so that nothing is visible. We can also use Invisalign, which is, a lot of people have heard of this. Invisalign produce a series of splints which look like this, and these are then fitted over the teeth, and incrementally the teeth move until you find that eventually the teeth are completely straight.
When I had Invisalign first fitted, I was concerned that people might notice that I was wearing a brace, and I would have felt fairly self-conscious. But I was absolutely amazed that unless I told people, no one was actually aware. One of the priorities in the practice is to stay ahead of the dental profession, stay right at the cutting edge. We've bought a BioLaser laser. We're employing high quality X-ray machines, digital X-ray machines.
We believe that prevention is better than cure, so we focus on giving the patients the information that they need so that they can go home and take proper care of their mouths.
He's taking so much care to look after your teeth, you then feel obliged yourself to actually brush properly. He knows if you've not been looking after your teeth, which is not a bad thing.
Dentistry really at the end of the day is about relationships and developing relationships over a period of time, and that's probably the most satisfying part of my job.
It feels like you're coming to see friends rather than coming to see the dentist.
I have never ever had any anxiety or whatever coming here and being treated in this practice.
We used to live in Yorkshire and still came down to Ian.
If by any chance I do have any more problems, I will definitely come to Ian for more cosmetic work.
It's a good experience. It seems a strange thing to say about dentistry, but it is. It's a good experience.